Welcome to the Effortless Swimming podcast. This is episode number 187. And my guest today is Brad Beer. He's a physio and a physio to probably a lot of names that you've heard in the triathlon world, the swimming world, the surf Ironman world, and probably the running world as well. And not only that, you're a pretty well-experienced runner and triathlete as well. So Brad, welcome to the show.
Brenton, thank you very much.
So your background as a physio has provided you with a lot of experience working with athletes of all levels, from probably fairly beginner level, but up to a lot of professional triathletes, and on from there. You've been the head physio at the Super League Triathlon, worked with the Bahrain endurance team. So what are some of these things that you've experienced and seen working with some of these guys at the very top?
Yeah, it's been a really great experience. It's been many great experiences, Brenton, and there's a few observations that I know you would observe too with your work with some of the pointy end swimmers. One is they're just so committed. Two, they're very intentional. And three, it's interesting. Sometimes the best performances seemingly come from the athlete that's the most relaxed on the start line. And that doesn't mean they're falling asleep, but there's a confidence within them. They know they've done the work. They're well prepared. So I always find that quite intriguing to be able to observe from behind the scenes what an athlete's, mental state is like before they take to the start line. So there are a couple of immediate thoughts, Brenton, and it's always just nice to see that they're very intentional about recovery, particularly the triathletes, highly attuned to data and workload. So they're very athletically intelligent athletes, the triathletes. They're really tuned in.
Is there any sort of common trends that you see at that level, whether it's with the triathletes or the swimmers or the surf Ironman? Any sort of common trends you see with injuries? Like what time of the season are they getting them? Are there some common ones that you see happen as a result of some mistakes that could be avoided? Those sorts of things?
Yeah, definitely. One would very clearly be, Brenton, on the other side of the off season. As an athlete matures in years, an endurance athlete, some athletes will take 2 weeks off, some will take 4 weeks. After an Olympic cycle, you often see, as you recall and know from the swimming world, often it's, maybe 4 weeks off of complete nothing because of that 4-year build-up or 5-year build-up for Tokyo. But one of the things you see with a complete off season where the athlete completely stops is on return to training for the running based athlete. So distance runner or triathlete, can absolutely be a swimmer as well or cyclist, is some onset of often soft tissue related injuries with the return to loading. And that's because across the 2, 4 or more weeks of cessation of training, there's some tissue deconditioning that happens. And then with resumption of the training load, once the load exceeds that local tissue tolerance, you might see an Achilles tendon become a bit sore or a rotator cuff in the shoulder. So that's definitely one time when athletes need to get it right, coming back from the off season to the start of training. And the other side of that is definitely towards the end of a long year or long season where an athlete's been doing the training, but also required to, race X amount of times. The triathletes might end up racing almost every weekend as they're into their World Triathlon Series events and events in between at the end of the year, Super League events, etc. So then you start to see that cumulative effect of workloads across a whole season. And that can also produce your soft tissue injuries, your bony stress injuries as well.
And I think that's probably relevant to at least us here in Australia at the moment. We're getting locked down left, right, and centre for a week or 2 weeks. Like it's on and off. And I experienced this just last lockdown. We had, I think, about 2 weeks out of the pool, came back and just didn't really give it much thought. Like I just went back to the same intensity that I was doing prior to that. And I'm feeling it in my shoulders. Just went a little bit too hard too early. And that was from just 2 weeks off. So what's the answer there? What's the solution for how do you avoid those injuries when you do take that bit of time out of the water?
Yeah, and we would all recognize that there needs to be a psychological refresh at some point. So the tapering and recovery experts all agree there has to be a down phase in the season or the calendar year. So if we make peace with it's not bad for someone to have a break, but as you say, there are key things to be mindful of on the return. And one is it's a progressive return to training workload. So we try and avoid the rules of twos, the rules being too hard, too quick, too soon, too much. I think we come back from an off season either really pumped up to get into it, or sometimes a little bit like I could have had longer off. But typically, I think most athletes are pretty motivated, so they come back ready to get into it and have their best season ever. Either they're building on a good year or they're trying to redeem themselves from a season that didn't go well, right? So that's one consideration, is just being aware of progressively increasing your workload. If it's running related, if it's running specific injuries we're trying to minimize, Brenton, we know that it's the magnitude of bone load that's more important than the number of load-in cycles in the risk of bone stress injury development. So how that practically might look is an athlete returns to running, a triathlete, for example, after some time off, restore the volume, the minutes of training for the running, say it's 5 hours a week or 8 or 10 hours, whatever it may be, 3 hours, before that athlete starts to add intensity, because it's the magnitude of bone load, which is a function of the speed of running, that is the greater risk for a bone stress injury. So that's a key principle that athletes should be trying to not violate. And the other part of trying to minimize injuries on return from an off season would be the tissue capacity of our bodies. So when we have a break, it down regulates, we do get deconditioning locally and more globally. So as the workload's increasing, the body's tissue's capacity, which you can think of in very simple terms as the strength, if you like, of the body or the tissues, needs to be increasing as well. So that's a progressive attempt to be doing some strength and conditioning work. Now, that can be as simple as poolside work for a swimming athlete, gym work for any endurance athlete, home programs. There's lots of ways to skin that cat, but we need to remember as the workload increases, our tissue capacity needs to keep pace with it. And normally with these injuries, these overuse injuries, it's as simple as the workload exceeded the tissue capacity.
And what about strength versus mobility? If you were to prescribe, if you had to say, let's say it was an hour a week, how much of each one would we want to be doing? And obviously it's going to be different for different people, but where's that sweet spot typically lie on how much of each, and how do they go together?
Yeah, such a great question. And it's always going to be individualized. We all recognize that, but just to sort of give a conceptualized answer, remembering what we just shared, and that is that it's the deficit in tissue capacity, which is primarily a strength or a weakness of certain tissues, that presents the problem. It's not typically because an athlete's gotten stiff on an off season or during the season. It's because the workload's gone up and the tissue capacity, rotator calf muscles that affect the Achilles tendon, muscles on the side of the hip that affect the tendon on the side of the hip, they have not kept pace. So if an athlete had an hour a week, and I know it's a fun little game, I would love them to spend 60 minutes of the 60 minutes available working on tissue capacity, endurance, tolerance, and all those factors. Now, that is not saying that a bit of mobility work hurts or isn't important, but it's just stating how important the strength and conditioning element is for an endurance athlete. If they only had 1 hour.
Yeah. That's good. That's really good. And you host a podcast yourself, the Physical Performance Show. You've had a lot of elite athletes on there as well, from runners and swimmers as well as triathletes. And with those guests, has there been anything that's come out in conversation that's perhaps surprised you, or that has led you to taking that on board and implementing that as part of your sort of physio practice, or how you go about your own training? Has there been any examples of that?
Can I give you two things, Brenton?
You certainly can.
Well, the first would be, it's always, we ask one set question, two actually at the end of the show. And one is, what's one key piece of advice you could dispense to help people listening perform at their best? And whether it's a featured expert, athlete, coach, it's surprising, but not surprising at the same time, how commonly people talk about consistency and being consistent. And it's kind of almost fun to hear, because we know it's important, but I don't think we can be reminded enough on how important it is. So that would be one of the key themes that's emerged across the 5 years of sort of weekly outputted episodes. The other key theme, Brenton, which I've certainly taken on board as a practicing clinician, a sports physio, but also as a keen recreationally competitive athlete, is just the importance of fueling. And if we talk about ways to try and minimize injuries, well, arguably this is probably the biggest emergent theme for endurance athletes in the last decade of sports medicine. And that is, as an athlete's workload goes up, their fueling needs to keep pace. It really affects things like bone stress injury risk. If an athlete has 3 or 4 indicators of low energy availability, then they are at 15 times greater risk of developing a bone stress injury. And how often do you see elite runners, triathletes succumb to a bone stress injury that really cruels their season and all that momentum behind it? We've featured some key minds on this, dietetic experts, physiologists, and it's a common theme. And the summary of how to fuel for your training is fuel for the work required. So if your workload goes up, athlete A, B, or C, please fuel accordingly. We often don't change our eating patterns much, yet it's not difficult for a triathlete, for example, to go from 10 hours of training a week to 15 hours. There's a 1/3 greater demand on the body for fueling, yet we wouldn't eat necessarily 30% more. So that deficit can quickly add up, and it can really result in an increased risk of injury, and it can certainly decrease performance as well, which is just, it's comical in the sense, not comical in the outcomes, but comical in the sense that we're training harder to try and improve performance, but we have a handbrake on it because we don't have enough fuel on board to power the adaptations to the workload.
Is there a couple of things that you would keep in mind when it comes to the fueling in regards to like eating beforehand? Is it more important to make sure you eat afterwards and refuel? Like where does that lie for you and what you've found?
Yeah, and this is certainly a sports physio. This is not my department, but in learning from the guests that we've featured, one of the key things is fueling before sessions. So I grew up like you did, Brenton, swim training in Australia. We'd be at the pool at whatever time in the morning, often straight out of bed. Most times I wouldn't eat something before training. And last year I turned 40, and I wanted to tick off an Ironman as a lifelong goal. So I did one several weeks ago. And in the lead up to that, I'd had a few bone stress injuries, Brenton. So I was very aware of making sure my fueling was where it needed to be to try and avoid another bone stress injury. So I was very intentional about eating before every session, eating after. And then something I often tell athletes as they recover from a bone stress injury is eat more than you think you need. So we underestimate how much fuel we need. It's very difficult to eat enough when you're doing 10 hours plus a week of training. So I'm, personally sort of sticking food in my face most chances I get.
Yeah. And what about now? Has that changed since completing the Ironman? What sort of training volume are you doing at the moment?
Yeah, well, it's gone from sort of 15 hours a week, Brenton, to around anywhere from 8 to 12 at the moment. So it was meant to be the Gold Coast Marathon this weekend, but sadly, as many people be aware, that got cancelled with COVID.
And with your, so you were competing in triathlons at least like sort of 9-10 years ago. You were, I think it was Australian age group champion for Olympic distance, 30 to 34-year-olds. Yeah.
Correct. Yep.
So you're pretty well-experienced triathlete. What was your background in swimming? Did you grow up as a kid swimming? And was it something you had to take up as an adult?
I was fortunate to get into a pool the moment I wanted to start doing triathlon. So we both know that if you start later, it can be a bit more challenging to come up to speed as quickly as someone that's got those skills from early on. So I started swimming, Brenton, at 11 due to a friend of mine at Grafton High School, Gordon Kilby. who actually reminded me recently that I reminded him, actually, he commented on a post I put up about my Cairns Ironman performance. And I said, you were the reason I started swimming good. And he said, you were the reason I stopped. So it was Gordon Kilby that got me into swimming in Grafton, Brenton. But I fell in love with the domestic triathlon scene on TV in the 90s, the Tui's Blue, the Accenture series. It had a few naming sponsors over the years, but Brad Bevan was the dominant force in that domestic televised triathlon world. And he was what I wanted to be in life, Brenton. So that was my early start at 11 in triathlon.
And haven't you gone on to sort of work with Brad Bevan and probably a bunch of those guys that you aspired to be?
Yeah, I often think about that. If you had told that 11-year-old starstruck boy that one day you'd get to work, in the end of their careers, with these guys, and athletes, I should say, I never would have believed it. So I never had two paths in mind, triathlon or physio. So it's been fun to morph the two together.
Yeah, I can imagine. Is there anything that you've, because for me personally, right? So coaching a lot, and then when it comes to my own swimming, sometimes I sort of take my own advice that I'd give to other people, and then sometimes I do my own thing because it's just what you do. How's that been for you in treating people? Have you had injuries because perhaps you haven't followed the own advice you might give? What's that balance been like?
Yeah, that's a brilliant question. I'd love to say I always practice what I preach. However, I don't. And just like any athlete, I'm fallible to get it wrong, sometimes more often than we get it right. So I've made most errors over the years. And in some ways, I'm happy to be a guinea pig because it does give you professional experience with these injuries. But I think Strava and the uptake of these digital platforms has kept a lot of athletes, including me, quite accountable, because I do often get a comment or two on my Strava account. If the session seems a little bit long or hard, I might get a couple of people sort of commenting on that. So there's an accountability that's brought to me, which is good. But I've practically made, so many mistakes over the years. I went through about 5 or 6 bone stress injuries in a 10-year period. I haven't raced a marathon since New York in 2015, and this was to be my first one 6 years later. And the reason is I've sort of bounced from bone stress injury to bone stress injury. So that's really forged a real passion for me to understand that space better. And I love treating that in clinics now, and the number one reason, top two reasons I've developed those over the years looking back, were I was simply underfueled. I was in the treatment room X amount of hours a day, all week, not eating, just running from appointment to appointment. I'd train in the morning, train in the afternoon. I simply wasn't fueled enough. And I was just doing too much intensity running in there. So it was a perfect recipe for bone stress injuries.
And why does underfueling lead to bone stress injuries?
Great question. So if we think about training, to answer this simply, Brenton, we know that it's not the training that makes us fitter. It's the adaptation to the training. So that adaptation is driven by our hormones, our sex hormones, testosterone, estrogen, growth hormone, etc. And when we're underfueled, that whole hormonal axis down regulates. So we don't have the same firing, if you like, or hormone health or hormone profile that we otherwise would. So that can manifest in for female athletes in lack of menstruation cycles or irregular cycles. For males, that can manifest. This is something that's been more openly discussed now and known and shared between practitioners and patients, is erectile dysfunction. So that can look like less morning erections for male athletes. And I know it's clunky and awkward and everything else, but it's really important. Female athletes have a very clear scorecard, and that's, did the monthly cycle happen? Yes or no? If not, there may be an underfueling component there, particularly if it's gone on for 3 consecutive months. So this hormonal downregulation affects the reproductive systems, and it affects bone health. So if there's not enough fuel on board, then bones can lose density, which increases the risk of a bone stress injury. And then it's a hard thing to have shown in the science, but it would make sense that if bones are at risk through underfueling, so too are soft tissues, tendon injuries, which is one of the most common triathlon-related injuries and swimming-related injuries if we think about the shoulder. So to summarize and simply, we need those fuel levels to optimize our hormonal profile, which they direct everything, whether it's our reproductive system, our tenocytes for our tendons, our bone cells for our bones. It's the key.
I was chatting with a lady who does sort of that kind of work with the elite athletes, primarily females, and she's done a lot of work with the women's AFL, talking to some of those teams and that kind of thing. And she was saying that when she was an athlete, she was a runner as a junior, and it was basically if you had your cycle that month, then it was seen as a failure. You haven't trained hard enough. Maybe you've eaten too much. It's like, so it was so backwards. And so her education now and what she's trying to teach and get across is that is exactly that. It's like, your overall health is much more important than being underweight and really like to be able to run fast, because that is not good long term, and it's probably not going to be the best thing for your sporting sporting results in the long run as well.
Absolutely, it's not just about health, because a lot of highly ambitious, motivated athletes would choose a performance outcome over their long-term health, like in the short term. Like it's not unexpected. That's why they're elite athletes. But you don't have to choose between them. In fact, if you want optimal performance, you need to have an appropriate level of fueling. You need to have a maximized sex hormone profile, all of those things. And in the swimming world, I can't recall the exact paper, but I recall Dr. Margot Mountjoy on an expert edition of the podcast I host, the Physical Performance Show. And she's an IOC sports doctor who was really the one that championed the change in naming from the female athlete triad to what we now know it as relative energy deficiency in sport, because 50% of the athletes on the planet are males. It affects males too. They just don't have a menstruation cycle. Dr. Margot Mountjoy spoke about swimming outcomes, and they ran trials where they looked at swimmers that were purposefully underfueling versus those that were fueled appropriately. And I think it was a 400-meter time trial. Their 400-meter time trial performance was down in the group that wasn't fueled appropriately. So we don't have to choose between long-term health and right now performance measures. In fact, you can have both if you eat your cake and eat it too. If you have your cake and literally eat it too. So there's a greater awareness, and it's something that I'm so passionate about as a health practitioner, is educating athletes about this. I look back at my 10 years of junior triathlon from 10 to 20, and I was likely underfueled the whole time. And I picked up low bone density as a 36-year-old. I found I had osteoporosis in my lumbar spine, and I'd always lived a healthy life. I was pretty stunned. I went and had my bone density check done purely as a interest, just to see where I was at, and couldn't believe the results. Now, fortunately, I picked it up. I've worked sort of diligently in the last 4 years, and I've improved that. It's now in the osteopenic range in my lumbar spine. 70% of our bone density is genetic, but I look back and I do think the lack of knowledge in the 90s and the underfueling was no doubt probably part of what I'm now experiencing.
There you go. And with the swimmers that you have come in to the clinic and that you work with, is there something that you typically prescribe for them if they come in with shoulder injuries and those sorts of things? I mean, the majority of issues that I come across when people come to our clinics is shoulder injuries, which is no surprise. And sometimes it's caused by technique. When we slow it down, we see there's a pretty obvious reason why you're having pain and issues there. But then some of it is perhaps overuse, or it might be just from sitting at the desk and having a bad setup. There's so many things that can cause it. Is there some pretty common ways to overcome some of these injuries that you see?
Yeah, definitely. It always is prudent to have an accurate diagnosis, Brenton, because once that diagnosis is made, then you just apply the right principles to get the treatment outcome you're after. And to think simply about shoulder pain, a UK colleague of mine, Adam Meekins, who is a well-known shoulder Focus Physio. Adam speaks about breaking down shoulder pain into really 4 groups. 1's the weak shoulder, 2's the stiff shoulder, 3 is the unstable shoulder, and 4 is the shoulder pain referred from the neck. So if we quickly rule out a few, we'll be left with 80% of the presentations that the swimming population, the triathlete population will experience, and that's the weak shoulder. So then the neck referred ones from nerve roots in the neck, mind you, there can be very rare occasions where people have a bony growth on their shoulder, and that's why someone presents with shoulder pain. Often it's very good to have an x-ray. The unstable shoulder, that can present problems. You know this, Brenton, from the elite swimming world. There's often such great mobility in these elite swimmers, and sometimes that can become pathological. So that's that excessive range of motion which we see in the elite swimmers. It can be people that have had trauma to their shoulder, so dislocations, etc. The stiff shoulder you don't tend to see outside of the very mature folks, so the people with glenohumeral osteoarthritis or arthropathy with a stiff shoulder in their 70s, 80s, whatever it may be. And that can also include frozen shoulders. Now, frozen shoulder is often overdiagnosed. Sometimes we lose a bit of movement, we get a bit sore and stiff, and we go, I've got a frozen shoulder. But a true frozen shoulder is often seen in the Middle Ages and more predominantly in women. And it will last 12 to 18 months. So we don't often see that in the active population so much. But the last category, the first category we started with there, which is where most of the listeners of your show, Brenton, if they've had a sore shoulder or if they develop a sore shoulder, will sit. This is this weak shoulder. So it's a soft tissue injury to the shoulder. And it tends to be, most of the time, a tendon-driven pathology or pain. So it's a tendinopathy. That term tendonitis is now dead in the water. We talk about tendinopathies, and quite simply, the reason it gets sore is because the training workload, like we touched on at the very start, has exceeded that shoulder or the rotator cuff's capacity to cope with that workload. So the way we get that right is we increase that tissue capacity at the shoulder, and that's through exercise. But Brenton, the exercise has to be progressive. You can't get some exercises day one and still be doing them in 6 weeks. There needs to be gear changes along the way to make that harder and heavier, and therefore develop better strength and soft tissue resilience.
I think you put that pretty well. That's interesting. So it's I'm just thinking of the swimmers that I have come across that do come in and they do have some issues with the shoulder. And I think thinking about a lot of them will spend a bit of time out of the water to let their shoulder heal, and then they'll get back into it. Now, we sort of talked about this at the start. What would be maybe the right approach for those that have got pain? Obviously they should go and see someone like yourself, like a physio, to go and get it treated. But would that time out of the water, if it's 3 or 4 weeks, would that actually potentially make it worse?
Great question, Brenton. I think if people think about injury rehabilitation or recovery as a two-sided coin, and on one side of the coin, you've got this strategy of calming symptoms down. So calming down the upset, sore shoulder. How do we calm it down? You just mentioned it, Brenton. It might be necessary, or it might be wise, to have a period out of the water. So whether that's 3 days or 2 sessions or 1 week or 2 weeks, that sometimes is a key requirement to get a timely outcome with recovery. Someone needs just to chill out, take some time out, let the shoulder settle down. So that's reducing pain. That can also be achieved through medication, anti-inflammatories, for example, when appropriate, analgesics where appropriate. Occasionally, you might have a reactive bursitis in a shoulder that could benefit from a corticosteroid injection. These are all calming down strategies. Soft tissue work, manual therapies, all the things that encompasses. So that's one side of the coin. The other side, Brenton, is the building up, the strength and conditioning. So they're both required. Where people often get disappointed, and you would have seen this, and disillusioned, is they take the time out. It feels better because they're not using it. They're relieved. They're happy. Coach is happy. Let's get back in. They get back in the water and the shoulder gets sore again. And the reason for that is because the swimmer or the athlete hasn't addressed that strength deficit or decrement that existed. So when people are out of the pool, it is an ideal time to be working on that shoulder strength deficit. And that's got to be objectified. It's no good just throw in a bunch of stuff. You need to know where your gaps are, what the numbers are, and then you get to work to improve it, because we know that what's measured gets improved, right?
And what are some of those things that they should be measuring, and how would they go about it, or how would a professional like yourself go about it?
Yeah, it's great. I term it sort of in my notes, I even put capacity testing. So if it's a case of a shoulder, we'll use a handheld dynamometer like this, where you have a swimmer pushing into it. There's a couple of different ways you can test it, a make test or a break test. So developing force maximally, or just quick hard force development. And you'll have a swimmer up in, say, the abducted 90 degrees. It's a common piece of gear here. It's going out of the room right now to the next room. But you'll have a swimmer up in, say, a 90 position, externally rotating the wall to do that. Internal rotation, we'll test that. Flexion, we will test that often. Abduction. So all the key areas. We might do something as simple as a push-up test. How many push-ups can someone do before their shoulder gets sore? So we're thinking locally about the shoulder, and then there's other tests we might do, Brenton, further afield. So we might want to get some side bridge measures or some hip capacity testing done as well, because we know that there's a whole kinetic chain that's involved for swimming, right?
Yeah, fantastic. Well, that's answered a lot of questions that I had for you. Having the expertise that you've got, and I like the fact that you're a triathlete, a swimmer yourself, because I think there's so much that you can take on board from your own experience when you're delivering that advice. And because often, when I was a junior, a lot of my teammates would go and see physios, and they'd say, like, don't swim for 2 weeks. And it's like, you don't swim, do you? Like you probably don't do any or much sport. It's like, so then, we ended up changing and seeing people who knew the sport and knew what had to be done. And the results from that, were a lot better, rather than just telling people to stop doing completely what they were doing. And because you lose your swimming fitness and your feel for the water so quickly. And so you needed strategies to mitigate that. And so often that would be kicking with a kickboard if you couldn't swim at all, if you had really bad shoulders. But having people who've got that experience, because it helps so much in physio. So I think it's great that you've got such a depth of experience in both of those worlds.
And on that, I often say it's easy and often lazy advice. Sometimes it's entirely appropriate, but when it's appropriate, fine, because there's times when people need to take time out. But bone stress injury, you can't run through that. A really stirred up shoulder that you can't swim 50 meters with, right out of the pool. But it's easy and lazy to often just say, take time out. It's difficult to work with an athlete to get them finding their zone of tolerance. So if someone is given that advice, ask questions about why, ask questions about what you need to do in that downtime, but maximize it. There's stuff you typically could and should be doing.
Yeah, it's the equivalent of like a swim coach saying, you're dropping your elbow, get it up. It's like, well, how do you do it? It's like most people don't know how to do it or how to develop it. So it's very easy to say what they're doing wrong. The harder thing is to give them a way or a method to be able to change it and explain what they need to be doing, rather than just telling them what they're doing wrong. And it frustrates me as a coach when when people will get told those sorts of things, those simple, like one-off sentences or words, but it's like, no, give me something to actually do to change it. Don't just tell me that I'm dropping my elbow all the time. Like I say it all the time. It frustrates me as a coach.
The other frustration I have, Brenton, just like you shared there, is lack of communication between therapists and coaches. You would have seen it over the years. I've been told I can't swim for this many weeks, and you're left sort of as a coach going, well, okay, what else did they say? Like, in my opinion, that should never happen. There should be a phone call, a text message. It doesn't take much to the coach to say, here's where we're up to. This is what the athlete can do. Let's work together to make sure they're back as soon as they can. I assume over the years, particularly in the juniors, you might have seen that happen a fair bit, where the coach is pulling their hair out going, well, where are you up to with this? How long is it going to take?
Yeah, that's exactly right. Well, Brad, thanks so much for being on the podcast. And for those listening, where are you based if they need a good physio, and where can they get in touch with you?
Yeah, thanks, Brenton. I'm based on the Gold Coast, Australia. The physio practice is POGO Physio. I've led it for 14, 15 years, more or less, since I graduated. And Brenton, a lot of conditions, and this has been one great thing out of COVID, one great thing, that is most things can be actually treated remotely, because normally with these endurance overuse injuries, it's a mismatch of load and capacity. So as long as you're working on the load of the athlete and building up capacity, you can get an outcome. So if someone did need a hand, happy to help. Happy to get emails, b.beer@pogophysio.com.au, and available. I'm on all the socials as well, at Brad_Beer, Brenton.
Fantastic. Well, Brad, thanks so much, and appreciate you jumping on, sharing your experience with the listeners. And yeah, it's been great. I was great to be a guest on your show as well, and you're 270 odd episodes deep now. So you've been doing that for a while, and congratulations on doing that many episodes as well. Because it's as a host myself, like I know the time it takes to do this, but I think personally too, it can be a bit of a not a selfish thing in a way, where it's like you get to learn so much. And so I've really learned a lot today, and some stuff I can apply to my own swimming and to my coaching. So from a selfish point of view, thank you for sharing all this too.
Oh, well, it's mutual. I've been working on my power diamond, Brenton, in my swim stroke. So thank you.